So imagine a world where you can become a dentist a full year faster. You save time, you save money, and you start earlier. Sounds amazing, right? Well, that's exactly what this new dental school in New York City is actually promising. But is it actually a good idea? What's going on, everybody? My name is Dr. Eli, and welcome back to my YouTube channel. In today's video, I'm going to be talking about the brand new dental school that is opening up in New York City, Yeshiva University College of Dental Medicine. This is the first dental school to open in New York City in over 100 years, and they are starting their school out with a 3-year dental school curriculum. The major selling point that puts them at an advantage over the other 5 dental schools in New York City. I believe this school is expected to open within the next year or two, and I want to talk a little bit about new dental schools in general, the effect of a new dental school while all this stuff is happening with the big beautiful bill, and the effect of opening a new dental school in an already saturated area like New York City. In general, I hope you all are able to get some information about the new dental school here, but mainly this video is going to be a little bit of discourse about what effects this new dental school will have and what changes they're making and how they plan to market themselves to put them at an advantage over other New York City dental schools. So without further ado, let's get into the video. Before we start, if you're new to the channel, my name is Dr. Eli. I am a first-year orthodontics resident, and I recently graduated dental school in 2025. On this channel, I make videos with advice for pre-dental students, as well as vlog my dental school and my residency journey. So if that's something you're interested, please make sure you subscribe and make sure you share the channel with anyone else who may find it interesting. So I came across an article titled Yeshiva University Launching College of Dental Medicine, a game changer for New York City pre-dental students. This article is from the June of 2025, so some of the things I say may seem a little outdated, but it's fairly recent. So to give you a little context about some of the things I'm going to be discussing in this video, number one, as you probably know, Donald Trump passed the big beautiful bill which limits federal loans for students, and it heavily affects students that plan to attend dental school because of the cost of dental school. Federal loans are now capped at a lifetime limit of $200,000, and New York City is no cheap place to go to dental school. It's expensive to live, it's expensive to attend school. Now, for those of you who don't know, New York is already one of the states with the highest number of dental schools. In the city alone, you have NYU, Columbia, Touro, and on Long Island, you have Stony Brook University. More north, you have University of Buffalo, and now for the first time in 100 years, New York City is opening another dental school in Manhattan called Yeshiva University College of Dental Medicine. Now, as I mentioned, this is a 3-year dental program, so they are marketing, getting students into their schools by offering 1 year less in training, getting students down to the workforce quicker. And this is a model that has already been adapted by a few schools, mainly University of Pacific, which has been a 3-year dental school for a while, and Midwestern University of Arizona, which I believe just recently moved to a 3-year curriculum. But I begin to wonder, is opening a 3-year dental school in New York City really the smartest thing to do? When you think about these cities that already have 3 dental schools, there's already a limited patient population that you're choosing from. Now, don't get me wrong, New York City is a very populous city. However, I'm very highly concerned because most recently we even heard of Touro College of Dental Medicine, another university in New York City, opening a clinic in the state of New Mexico, and they're shipping half of their students off over there during their 3rd and 4th years to get clinical experience. Now, why they're doing that, who knows? It could be a money thing. It's probably a money thing, but also there's a very high chance that they were finding that their students just weren't able to get as high of a clinical experience as they could because New York City is so populated and so saturated with dental schools. Quick intermission to the video. If you're watching the video and you've made it this far and you're enjoying the content, please drop a like on the video. It's right here under the video. Just click the little thumbs up button. It's of no cost to you, and it does so much to help boost the video and the channel in the YouTube algorithm. Thank you so much, and I hope you enjoy the rest of the video. Now, I went to a school that was in a city with 3 dental schools as well, Boston University, Tufts University, and Harvard University. And I will say 2 of the 3 schools, Boston University and Tufts, were known for having a high patient population. And yes, occasionally we did run into issues where it seemed like there weren't enough patients to go around, but but I didn't have any problem meeting my graduation requirements. And the good thing about what we had at my school and at Tufts is that we had externships. And on your externship, you would actually see a high volume of patients and get a good clinical experience as well. Now, I don't know the individual curriculum at all the different schools in New York City and if they have something similar, but the fact that Turo is sending students to New Mexico is definitely something that raises an alarm in my head. So now you bring in a new dental school and students are already sort of being shorted their clinical experience because they have 1 year less of dental school, but you may also be shorting them of their clinical experience because there may not be enough patients. NYU is also a very large dental school with a lot of students. These students need patients to work on and to get clinical experience. It's just very alarming, and to be very honest, 3 years sounds like a great idea to almost every pre-dent in the world. It's less money you have to spend, it's less time you have to spend in dental school, but will you be prepared to enter the workforce when you're done? Sure, you're gonna take the same board exam, sure, you're gonna take the same clinical exam, you'll be licensed to practice, but will your speed be up to par? Will you be able to see the same volume of patients? Will you be able to make the same money and produce the same as a graduate who went to a 4-year dental school or even one who did a residency program afterwards? These are the things that people don't really consider when they're just pre-dents and they're just trying to get into dental school. But this is something that I'm really concerned about with an opening of a new school in an already very populated area that is shown to have issues by what you've seen happen at Toro College of Dental Medicine. Nonetheless, I'm not here to talk about whether Yeshiva University should open or not. They're gonna do it anyway, and it seems like they may have already accepted their incoming class. But I just want you all to beware, especially because I know a lot of pre-dents watch this channel and a lot of people are probably looking for information on a university. There are questions that you should ask in your interviews if you decide to apply and go to an interview and possibly attend this dental school. Now, I'm sure and I'm hopeful that Yeshiva University, like other 3-year dental schools, are going to start your clinical experience much earlier. I've been saying for a long time that I think students should really be starting their clinical experiences in their 2nd year with prophies and new patient exams and things that aren't as invasive. That way in your 3rd and 4th year, you can be focusing more on procedures that you would be doing as a dentist and less on hygiene procedures, because that's what a hygienist is hired for anyway. You're fine. Of course, like I mentioned, there are a lot of pros to attending a 3-year dental school, especially with the big, beautiful bill coming in. People are looking to spend less to go to dental school because you have to start taking out private loans for just about every dental school now, because $200K just isn't enough. I barely know any people who had to take loans out for dental school and had to take less than $200K to cover everything as far as tuition, living expenses, etc. But of course, with the 3-year curriculum comes more rigor, a faster pace, and the potential of shorting yourself of a clinical experience. But essentially, Yeshiva University kind of has to do this. When you're in a city that already has 3 other dental schools, you have to find things that help you compete with the others. Now, for example, my school, Boston University, our competitiveness that we had with other dental schools as a business model is that we were open on Saturdays. That allows people to come when they don't have to work or they don't have to take off of work to be seen. And that's something that you have to do when you're in a place like Boston or New York City or Los Angeles, where you have to compete with other dental schools for a patient population. So I wouldn't be surprised, especially with the shorter amount of years that Yeshiva University has, if they start introducing a model like that, where their clinic is open on the weekends, or like my school, they have evening clinic every day except for Friday evening, things like that. But this starts an interesting dialogue. Do you think more schools are going to head towards a 3-year curriculum, especially because a lot of people think that dental school only needs to be 3 years as far as didactics and in-person lectures, and your 4th year could be fully in clinic like a residency year, things like that. With the big beautiful bill and the potential effects it has on reducing the number of students that are able to attend dental school in general, do you think that dental schools are more likely to transition to a 3-year curriculum to make their schools more affordable for people? These are all things that we should probably be thinking about in advance, because if the legislation doesn't change with a new regime in the next 4 years, we may see trickle-down effects on medical school, dental school, education, clinical experiences, etc. So let me know what you think. Would you do a 3-year dental school with everything that I discussed today? Would you consider doing it in a less populated area versus New York City? If you're a pre-dental student and you got something from this video, I definitely recommend you share with a friend, subscribe to the channel, and check out my pre-dent advice playlist if you're looking for other things regarding getting into dental school, taking a DAT, and things like that. That's all I had to say for today's video. I thank you all for watching, and I hope to see you all in the next one. Peace.